Congratulations on the birth of your baby. This is an informational video to discuss proper bottle feeding techniques for babies with a cleft palate. There are many different bottles available, and it's important to work with a cleft palate team or a cleft feeding expert so that you know your baby's nutrition is maximized while their energy expenditure is kept to a minimum during the feeds. Giovanna is a pediatric speech pathologist. She is demonstrating a Mead Johnson bottle. It is a soft bottle, and it requires you to rhythmically pulse or squeeze the bottle while your baby sucks and swallows. Too much squeezing will create overflow and leakage of fluid or coughing and sputtering through the nose. Under-squeezing will leave you with a hungry baby. This bottle comes with a nipple that is long and firm. We typically change out the nipple with an orthodontic nipple. Your feeding therapist can help determine the best nipple for your baby. This is a Dr. Brown's specialty feeding system. It is just like the original Dr. Brown's bottle, but includes the infant paste feeding valve, which is a one-way valve specifically designed for babies with a cleft palate. You don't have to squeeze the bottle, and therefore it allows for more of an infant-led feeding experience. For maximum control in feeding even the most challenging babies, the Medela Special Needs Feeder, previously known as the Haberman feeding system, is recommended. This is particularly helpful if your baby has a small jaw or Pierrot band sequence. It also has a one-way valve and allows you to squeeze the nipple or provide pressure to help your baby express the fluid with more control. In addition, you can turn the nipple in order to increase or decrease the flow rate. It is important, regardless of the bottle you choose, that you allow frequent attempts at burping, and it is helpful to keep your baby positioned somewhat upright and hopefully wide awake during the feeding. It is also important to try to keep feeding time to 30 minutes or less.
With all bottles, it is important to disassemble and clean all the parts after each feed and allow them to air dry before using them again. You should never put them in the dishwasher because the nipples can deteriorate. Be sure to keep all the pieces together because they can be easily lost. At Florida Craniofacial Institute, as well as at St. Joseph's Children's Craniofacial Center, we have feeding experts who can help determine the best feeding system for your baby, and replacement bottles are available for our team patients at no cost. These bottles can also be purchased at retail stores or online.
I hope this video was helpful. Feel free to contact us with more questions or to schedule an appointment either before or after your baby is born so that you can practice with all the various bottles and ask questions to the experts.